If this is not your first acne treatment or you've tried a lot of things and none of them work so far, this video is definitely for you, because today we're gonna finally understand what was wrong with all the treatments that you tried and none of them gave you the result that you wanted: clear skin. If the acne treatment that you're doing now is not really giving good results and you're a frequent visitor at a dermatologist's office, you can say that you tried almost everything, starting with non-prescription to prescription medication, and you still haven't achieved the result you wanted, or you achieved it for a very short time. You might have also tried a lot of social media hacks and tips like diets, different products, different skincare products to improve your acne, and you still haven't achieved the result you always wanted: clear skin with no pimples for a longer period of time, not just a month or two. If you find yourself in one of these situations, you want to continue watching this video, because as a dermatologist who treated more than 7,000 patients, today I'm gonna tell you 3 reasons why people with acne are struggling years to deal with their problem, and many of their treatments fail. Even the ones that were prescribed by dermatologists, or the ones that their friends tried, and those went well. So based on my practice, I will tell you why exactly you haven't achieved a good result and you're still not happy with your skin, even if you tried almost everything, starting with non-prescription stuff like skincare, diets, different cosmetic procedures, ending with prescription medication and even isotretinoin or Accutane, because there are a lot of cases where people still have their acne after finishing this treatment. Let's start. First of all, I feel like I need to tell you that my family had a very long and complicated history with acne. Although my parents, neither of them had acne, me, my sister, and my brothers, all of us had acne. And I kind of got to understand it better when my sister suffered from this rather unpleasant skin condition, and she tried everything. She's been to a lot of dermatologists in Germany, and they prescribed some stuff that didn't work. Like, she tried for months, for years, and she still continued to get pimples. And I remember how difficult it was for her, especially when parents, when people around kept asking, why are you not doing anything to your skin? Maybe you should try this, maybe you should try that. And that's basically the story, well, of every person who has acne. All these treatments that failed, all these recommendations that you tried, you end up at a point where you think it's just never gonna get better, and you're just so frustrated, and you think like, maybe you should just leave it as it is and hope for the best. So after my huge experience with acne patients, I can definitely say there are specific reasons why treatments didn't work. It's not because acne is a condition that's impossible or difficult to treat. It's because many patients are simply doing the wrong thing, and many doctors are just not giving enough information to help the patient deal with this skin condition. And let's start with understanding 3 main reasons why this happens. Reason number 1 is the fact that your dermatologist never took the time to explain you what acne really is. In my opinion, it is extremely important to understand that acne is a chronic skin condition. Chronic means that this skin problem cannot actually be cured. It will last for most probably many years, in which it's not enough to just once treat it and then it's gone forever. It is very important to keep maintaining your result, even when you have no pimples and you achieved a good result in your opinion. Which means it is not enough to do nothing or just use skincare. It is important to continue a maintenance therapy, which most probably will be some topical prescription medication like retinoids for your acne, or in some people, topical medication is not enough and they have to pursue using some systemic treatments to keep their acne at bay or to keep it controlled so that it doesn't come back in a few months. Although it is unpleasant to accept the fact that this skin condition is not going away, and as good as the treatment might have been, it will not cure the problem forever. It might relapse, and most probably it will relapse if you don't continue doing something after your treatment is over. And from my experience, we achieved great success with patients, and we kept their skin clear for many years just with this simple rule. So in my opinion, if the dermatologist did not take the time to explain you why your acne appeared, that it is a chronic condition, that it will still be there after your treatment and you need to maintain some sort of treatment to keep it controlled, then it might be a big, like a huge red flag, and you probably need to find another dermatologist. The second, and I would say maybe the most important reason why treatments have failed, even if it was a very good treatment. And the problem here is that you were not told how to properly use the treatment. Most of the treatments in acne are topical treatments. It's either topical retinoids or a combination with antibacterial or other topical prescription medication. And most often, all of acne medication is quite irritating. It will dry out your skin, it will make it red, it will make it very angry, sometimes flaky and very sensitive. So when a person not being told all these important moments is starting a treatment and gets this super red, irritated face in the first few weeks, what I've noticed, most of the people, they think they're doing something wrong. So maybe this product is not good, maybe it's not good for my skin. The actual problem is that you need to know how to use prescription medication so that you can continue the treatment and not just irritate your skin and need to stop because you cannot tolerate it anymore. We must accept the fact that topical medication, topical prescription medication in acne is irritating in the first few weeks or maybe months, depending on your skin type. So it is imperative to start slowly. You never start using retinoids or other topical treatments every day. You need to start slowly and increase the frequency when you can tolerate the product better. It is also very important to take care of your skin, especially in the first few weeks and months of the treatment, because if you don't moisturize enough, you will end up with a very dry and sensitive skin. And when I mean moisturize enough, I mean a greasier, thicker emollients. These type of emollients are usually the thing that scares people with acne a lot, because what they think is, oh well, this one will block my pores, it will make my skin greasy, and it will only make my acne worse, which is completely not true. It is totally okay to use richer or thicker moisturizers to help your skin tolerate the product better. It is absolutely okay to layer moisturizing products and layer your prescription medication on top of your moisturizer to help your skin tolerate it better. And no, it will not make your treatment less effective because you use something underneath your medication. What I observed is that many people give up on their treatment, even if it's a very good one, because they simply don't know what to do in the first few weeks when this irritation appears, and it's called retinoid dermatitis, which is a very common occurrence in acne patients. And I could not emphasize enough how important proper skincare, proper moisturizing, and very gentle cleansing is. Last but not the least important part is, of course, time. What I concluded from all the stories that my patients have told me before is the fact that they're not giving enough time for their treatment to work. Important to know that we need at least 3 months for any acne treatment to start showing result. Sometimes it can be up to 6 or even 9 months for you to see a proper improvement. And as long as that may sound, that is unfortunately the truth. And frankly speaking, that is most often the case. We need a longer time before we see the result. There is absolutely no point in changing the treatment before the 3-month checkpoint, because you have simply not given the treatment the time to show what it's capable of. Most often, what you see in the first few months of your treatment is actually your acne getting worse. The process that we call purging, or the period of time in which you see many new pimples appearing. And that only happens because all the clogged pores that were already there the moment you started your treatment are just getting inflamed because of the irritating product that you started for your acne. Your skin just needs time to clear those up. One last important thing to say is that you should not give up if at the 3-month checkpoint you didn't get a good result, because this is just an indicator for your doctor to understand what's really happening and how can he improve or change the treatment so that you get a better result. It doesn't mean that the treatment was bad. It doesn't mean that the doctor is bad. It just means that your acne is individual and it might need a different treatment. Let's say if you were using a topical retinoid and at a 3-month checkpoint you didn't notice any improvement, you can either get another retinoid, because not all retinoids are the same, and if tretinoin didn't work for you, you can safely use another one and give it some time to maybe improve the situation. But sometimes, in some cases, topical treatments are not enough, and at that point your doctor will completely change you to another systemic or oral treatment, or add an oral treatment to your current topical treatment. So it's perfectly normal to discuss these concerns with your doctor and ask him what his plan is for the current situation and what you might do if you don't see any results after 3, 6, or 9 months. What I really wanted to tell you today is that even if acne is a very challenging, especially emotionally challenging condition, you should understand that there is always a way to make it better. So giving up is definitely not a solution, because most probably till now you haven't even tried the right treatment. It will help you control your acne and get a good result, not just for a few months, but for years ahead. And that we would call a successful treatment, when our patients are happy with the result and they can maintain quite easily the result for a longer period of time. I really hope this video helped you understand your acne better, and I promise that we're gonna have a lot more interesting videos for you to properly take care of your skin, to understand what went wrong and why what you're doing now is not giving you better results with acne, and what to look for. And of course, I'm gonna share cases of my patients, what we did and how we achieved a better result, so that you can understand what you might change in your treatment to finally get the clear, healthy and glowy skin that you always wanted. Subscribe to watch my new videos, and see you next time. Let me know in the comments which treatments worked or didn't work for you, and I will do my best to help you or guide you where you should go next.